another episode here at Live Plastic Surgery. We just wanted to inform you guys about the latest and greatest in terms of going big or going home in Texas. So things have kind of changed, right, in the last week or so.
That's right. So there's a new size of implant, the biggest that we've seen available on the market.
Absolutely, 1,400 cc's. It is definitely way bigger than the last biggest that we had, right? In terms of the biggest loser now is the 800 cc implant because the 1,400 cc implant is now taken over. Now, what does that mean for?
It's a pretty significant difference there to jump all the way from 800 to 1,400. Who might be a candidate for such a large implant?
Well, yeah, and I think this comes down to the chest width, right? In terms of chest width and proportion, not every person is going to be a candidate for this, right? You think about women that we do breast reductions on, where their breasts are so large that they're having neck pain, they're having shoulder strap moving, they're having back pain. Well, 1,400 cc implant is quite large, right? I think it's super important if there's any women out there, any moms that are thinking about going to this size, make sure you try them on, right? Make sure you feel the weight, right? Like that's one of our first steps when we do a consultation for breast implants is trying on the weight.
Definitely, yeah. The weight has a lot to do with how it's going to feel comfortable in your bra, on your shoulders. I know you often will pick it up and let the patient see how it's going to feel as far as the weight goes. If it's too heavy or the size looks right, that type of thing. What's the most you've ever taken out during a breast reduction?
Yeah, so breast reductions, we've taken out, close to 3,000 grams on each side, which is significant because each gram is a cc. You think about how much we're taking out, 3,000 grams, well, a 1,400 cc implant is like less than half, right, in terms of what could be in there. Now, the average size in terms of breast reductions that's there is over 800 grams or so, is where we're actually doing these for medical reasons where it's causing changes in neck pain, back pain. But that's just the weight part. The other part is actual location of the breast. The lower it is, the more kind of top heavy you are. It's a physics problem more so than just a weight problem of the breast. So it's a little bit different in terms of what symptoms you're having. But again, putting a 1,400 cc implant in can definitely reproduce the same symptoms that somebody would have that would require a breast reduction, right? So just make sure that you're trying these things on. And again, it's one thing about trying them on, but like leaving them in there in the tryout period for a few minutes or so you can feel like, hey, does it feel heavy or not? You might not feel it immediately, right? It's like wearing a ruck pack, right? Like you're like, oh, the ruck pack, I can handle it, this and that. Like 20 minutes later, you're like dying, right? You got sweat dripping, and that part of it, actually just getting yourself around. So I think it's super important to try those things on in terms of an implant, and then thinking about like when women need reductions, right? Because there's like a tipping point to say, hey, what looks good and what's too much and what's going to cause you medical problems versus what it looks like.
Right, definitely. So you talked about kind of putting everything in the right place with the breast reduction. What does that look like? You always talk about nipple position, putting it back in the right place. So what does that look like with the reduction?
Yeah, so I think it's balancing the top half of your body, right? So a lot of times when this weight's heavy, it's actually angling you forward, right? You're leaning forward, you're having that strain on your back. Now you have a bra that you're wearing to hold this up. Now you have the pain from the bra, now you're just displacing that pain on the neck, the shoulder kind of area, and the back itself in that part. So getting everything to be proportional. Usually that's different for every person. That's why we kind of tailor it to every person in terms of how tall they are to say, hey, it's halfway between the shoulder and the elbow, and that gives you an adequate position to say that's what's going to keep you in balance versus top heavy or leaning too far back or not feeling like you have anything there in terms of substance.
Oh, definitely. I know a lot of patients want to know, do you keep sensation in the nipples when you have to move it such a long distance? How does that work?
Yeah, and so most of the time we're preserving sensation, right? And majority of the time, depending on what we're using to resupply the nipple and areola. And having that in the right place, those nerves, usually we preserve them, either they're from the middle part or they're just from the bottom in terms of being able to provide that sensation and blood supply. They all kind of run in tandem. All that the nerves kind of run with the vessels as well. And so we're trying to get those to be in the right place to then provide perfusion and then also give that shape and land it in the right place to be perky and high as we know, gravity is going to keep doing its work.
Yeah, definitely. Unfortunately. All right, and what does scarring look like for something like that?
Yeah, so in terms of breast reductions, most of the scarring is around the nipple area down in the crease, and then the one in the crease itself, it kind of depends on how much of the side boob we actually have to bring in, right? So the more side boob, the longer the incision is, the less side boob, the smaller the incision is. And then the same thing kind of applies to these larger implants. Well, are the incisions going to have to be bigger? Probably to fit these bigger implants through a small hole to put them in the right place. That's one part of it. The other question that that is left to be answered since these new 1400s just came out is how quickly will they descend? Like, will they fall quicker? They're heavier now, right? Will they loosen any of those ligaments? Will you have a lot of droopy breasts in terms of positioning for these implants? Or is there going to be a lot more mesh that's used to hold these things up because they're a significant size and you're wanting to hold them in place? And then, I think the verdict is still out, like whether just part of it needs to have mesh, the whole thing needs to have mesh, and what is that going to be long term in 3, 5, 10 years from now from these larger implants?
Would you use mesh on every patient? Is there something specific you would look for as far as skin integrity, or is there like an age cap where?
Yeah, and so I think some of the kind of discussions that I've seen in the American Society of Plastic Surgery is that something over 500 cc implant, that's what you want to consider using mesh on those patients because there's just a volume that's there, right? In terms of reconstructive patients, we've seen mesh being used, different types of meshes that hold it in place. But I think it really comes down to how big of the implant you're putting in, especially if you're putting a 1400 cc implant, the biggest that's out there, it's going to need some side support, especially if you're putting it above the pec muscle or below the pec muscle. Either one of those two is probably going to require an added support structure, or else it's going to droop and things are not going to really be in the place that you want them to be.
Is this something that you could put below the muscle? Would all of that fit underneath the muscle?
Yeah, and it depends on the footprint, right? To say, hey, how wide are we going with this and how much are we stretching it? Is this a primary breast augmentation, which means the first time I've had it, or is this my third time that I'm switching these out and I want to go bigger, right? Do I already have 800 cc's and do I want to go up in size for the 1400 cc's? And knowing that part, that's what makes those decisions, and going to a board certified plastic surgeon, making sure you're having these discussions, asking the questions like, hey, what's this going to look like? What's this going to be in 3 years, 5 years? Do you think it fits my body shape, right? My chest width and that part versus doing something ridiculous, in terms of like somebody that's like 5 foot tall and putting in 1400 cc's.
Right.
It may not fit the frame of what they're looking for.
Yeah, definitely. Do we have any questions?
We do. So Gabby was asking, what is considered too large of implants from a medical safety standpoint?
Yeah, so that's a great question, and it comes down to a lot of the implant decisions that we make is how wide is the chest. The wider we go, the more it falls into the armpit, right? And I don't think that's something that any women like. They don't want that, right? They don't want to fall out to the side. They don't want everything to droop, and they definitely don't want to push down quickly over time. So I think that's what determines like the largest size you want to go, and then trying them on and saying, do they feel heavier or not? Now, if somebody already has 600 cc implants and they want to go bigger, then they can because they've already stretched out the skin. But going for their first breast augmentation and going from an A, they want to be a double D, it's going to be a far stretch in terms of getting that tissue to be there and fit that look in that moment.
Awesome. Sarah was asking, are there any specific risks associated with getting extremely large implants?
Yeah, and so I think that's a great question, right? The bigger the implant, the more surface area that you can have on the implant. There's just more silicone that's exposed to the body. Now, what does that create? I don't know if that creates anything, right? I just know that, hey, well, if you have more exposure to something, and if you possibly have an allergy to something, then you're more likely to have a bigger problem, right? Other than that, the other risks are just having to have a revision sooner, right? Or having the neck pain, back pain, and these other long-term, chronic effects of having large breasts.
It shouldn't increase the risk for like rupture or anything like that, right?
It shouldn't, in terms of the new technologies of how the implants are made, how the gel is made itself, and they've had to get it FDA approved, right? So they've done all the testing of, making sure they run over it with a tractor, but all the different things that
Just in case.
Just in case.
Awesome. Carol was wondering, what is the difference in saline and silicone implants, and which ones should I get?
So that's a great question, and it comes down to what are we starting with, right? And the majority of women in the United States usually use silicone implants because they feel the most natural. Now, saline implants are also an option. The outside shell of both of these is made of silicone, so it's no different in terms of the risks of what a silicone implant would be versus saline. There are differences in terms of if one pops, right? In terms of new ones, when a silicone implant gets ruptured or anything like that, all the silicone kind of stays in place. Versus a saline implant, well, all that water comes out and your body reabsorbs it. So the breast goes flat so you can recognize it sooner. So that's one of the advantages of the saline versus the silicone. Other than that, there's less rippling, less complications in terms of the actual implant themselves with the silicone ones as well.
Cool. Becca was wondering, is that a real implant that you have in your hands, and is it silicone or saline?
Yeah, so these are both silicone implants, right, that we have here. And the differences that we kind of wanted to show is that there are different profiles, which means vertical heights and the widths of these, and there's also different material that can be made on the outside shells. And so, but most of the outside shells are all made out of silicone. The whole nuance in terms of placing the right implant is determining how big do they need to be, what's the width of them, and what look are we trying to go for, right? The more cleavage, the more projection that you would have.
Awesome. Somebody was asking, what are the long-term effects of carrying heavy implants besides back pain?
Yeah, I mean, carrying heavy implants, it can be all the same things, right? Neck pain, shoulder strap grooving, sometimes it can lead to migraines as well, right? That people have talked about just because of what other muscles need to pick up for that weight and that you're balancing. Again, in the reconstructive patients that we've had for breast cancer, right? They've also done these studies of when a patient has one side done, they end up having hip pains. They walk different because they're carrying weight differently, right? So there's just things to consider when you're having these type of implants. Sure, it's more weight for you to carry. Well, that's more weight on your knees long term. Does that affect something else down the road? So there are these things to consider depending how big you go and staying kind of within reason.
Cool. Rachel was wondering, do patients who get massive implants ever come back for a reduction later?
Yeah, and so I think that we have seen a trend of the more natural look, or the smaller implants right now are in style, right? And so people are looking for that natural look. Well, they're sizing down, which means that we're removing the implant and doing the lift in terms of putting the nipple and the areola in the right place as a treatment plan for them, and removing that capsule for where the implant was, right? So it gives them the shape and it gives them a smaller one as well.
Awesome. Last question. What is the typical motivation behind someone choosing very large implants?
Oh man, that's a real good one. I think there's a psychology behind it, right? The go big or go home. I think it comes down to, hey, what do you find to be attractive? What is your version? Beauty is in the eye of the beholder. And then attention, right? It's one of the big factors that goes into it, and in terms of the psychology of whether it is for the woman or the woman's perception of what the male's perception is of her that finds her to be attractive. I think those are the biggest key factors of why, the whys behind it. And I think those are important to ask yourself before having a breast augmentation as well.
Awesome. I think that's all.
All right. Well, thanks for tuning in.